Hey, Amanda.
Ready? Are we set? Good morning. We're ready to start our mental health committee meeting. Is Rob in the room?
I am.
Thank you, Rob. I appreciate it. There you are. Can we first of all get a motion to approve the minutes of our last meeting? That being said, Supervisor McGowan, seconded by Supervisor Beatty. All in favor?
Aye.
Aye.
Great. Rob, carry on.
Okay, first item of business that I have is a request to amend the 2020 Warren County budget in accordance with some wage adjustment, COLA funding, and state aid that we have received in the amount of $61,943. This is 100% state aid from the New York State Office of Mental Health and the New York State Office of Addiction Services and Supports. And there's an attached table that shows sort of a breakdown of the funding and which agencies it's targeted for and which agency is funding it.
Great. Can I get a motion to get that on the floor, please? Supervisor McGowan, seconded by Supervisor Frazier. Any discussion? All those in favor?
Aye.
Opposed? No opposed. Thank you. Rob, continue on.
Okay, thank you.
Updates that you can help us with.
Yep, I just had a few program updates I thought I would give, just to keep supervisors aware of our status. The staff of the Office of Community Services continue remote operation, staying in touch with each other throughout the day by email and a weekly staff meeting via Zoom. Staff do go into the office occasionally. If there's something they need to do, then they do their function, they go home. All essential functions of the office have continued during the period of remote operations. As I mentioned previously, we have mental health support information listed on the county's COVID-19 web pages. We've also developed a virtual family assistance center with grief resources for families that have lost a loved one to COVID-19 or maybe have a family member in serious stage of illness. This resource is also accessible on the county website COVID pages. I'd like to thank Parsons Child and Family Center, Northern Rivers, one of our contract agencies. They operate a mobile crisis program, and they've offered their staff to be available as a first point of contact for these families. The clinicians offer telephonic grief support and referral to additional services as needed. And we've also conducted some targeted outreach to the nursing homes in the county with this information so they can help pass that along to families that are impacted. We have circulated information on dealing with the stress of the pandemic and self-care strategies to all county employees, and have conducted some targeted outreach to Warren County public health staff, knowing that they are also working long hours under stressful conditions. We continue active work with our providers around COVID-related issues as well. Providers continue remote operations, with most clients being seen via telehealth means. Providers have recently been engaging in active reopening planning, so they've started some of that. There is concern right now regarding impact of impending state aid cuts. Mental health and substance abuse services are both issues where we see an increase in demand at this time due to the pandemic. So we're concerned how those state aid cuts are going to come down. Also keeping an eye on any impending federal aid that we're hoping for. A few weeks ago, Glens Falls Hospital had furloughed approximately 50% of their outpatient clinic staff. But now they have been able to, now that they've resume some elective procedures, they're able to start calling some clinicians back. Behavioral health services are essential services, and all clients have continued to have access to medication management and refills, their clinical appointments, and crisis or emergency services. There was no impact to the inpatient services or the crisis unit or the emergency room crisis evaluations. The transition to the hospital's outpatient behavioral health services to citizen advocates has been delayed due to the COVID-19. We do continue discussions with all parties, and we're hoping to get a timeline back together once things start to reopen. Again, this may be impacted by the state aid cuts, so we're trying to keep an eye on that and see what the impacts are going to be. And again, I would just offer to the supervisors, if anyone has any questions, or if you hear of any constituents having difficulty receiving services during this time, feel free to let me know or refer them directly to me. I can be reached through my voicemail, and I check my voicemail throughout the day, each day. And that is all I have.
Thank you very much, Rob. Does anyone have any questions for Rob? You know, it goes without saying that mental health is a critical dimension in this whole world we're living in today. So we think everyone is appreciative of your help, and every day seems to bring an additional question to the services that are indeed provided. So I think everyone appreciates your efforts, Rob. Any discussion or questions on anyone's part? That being said, Rob, we thank you so much, and have a good day.
Thank you, you too.
Janelle. Is Janelle in the building?
Yes. Hi, good morning, everybody.
Thank you, Janelle.
Happy Monday to you. Our agenda should be pretty quick today. So first of all, we're looking for a resolution request to enter a contract with Health Research Institute and New York State Department of Health to accept emergency preparedness grant funding not to exceed $100,000 for the period of July 1st, 2020 through June 30th, 2021. This has been a grant that Health Services has had for many years now. The actual amount of the grant award is $49,625 for that period, but we thought it best to do not to exceed in case we receive additional monies related to COVID.
Thank you, Janelle. Can I get a motion to get that on the floor, please? Supervisor McGowan, seconded by Supervisor Conover. Any discussion? All those in favor?
Aye.
Opposed? Carried. Request to transfer funds. Janelle.
All right, I'm actually going to turn it over to Ton.
Attachment number 6, I just have one small transfer of funds for $76. This is just a transfer from full-time to overtime salary within our preventive program. We had someone who had to work on state aid, and we had, with everything going on, it was a little bit of overtime, which we don't have budgeted, so I just have to move $76 for that.
I'll move it.
Moved by Doug, seconded by Supervisor McGowan. Any discussion? All those in favor?
Aye.
Aye.
Opposed? It is carried. Any further items? Janelle, do you?
Yes, we have our report of expenditures and revenues that Ton will review, and then also the comparison report.
Attachment 1 are our financial status as of May 10th. We are in the process of closing our April billing. It does include our March billing in these totals. And I wanted to note down below again on the bottom of the page, our salary comparisons. We are 26.99% of budget currently, and last year at this time we were at 32.02%. I do want to note though, we're down in overtime. We're down definitely in our part-time salaries because we haven't utilized our per diems or our clinic nurses right now during this time. but I did want to bring to your attention that of the overtime salaries, about 23.82% or 8,790 is just related to COVID. So we would technically be down even more in the overtime salaries. It's just anything that's been over their normal and above 40-hour week, we're able to, and they're doing COVID-related items, we are able to bill that to the COVID grant. So I just wanted to bring that to your attention. On our attachment number 2, which is a comparison of last year to this year, gives you some idea. Again, the salaries, which I had noted, and equipment, I just have that we had purchased some vehicles and we're in the process of getting vehicles now. We're still waiting for one for this year. Regarding contractual expenses, which is all of our, basically everything that's related to our preschool program, our home care, everything. Our preschool program were much lower last year at this time. I think it's mainly due to, again, timing of paying invoices, and it does depend on how many kids we have, but at this point, we're slightly under with that. Our employee benefits, of course, are related to the salaries. Less positions that are open or salaries that we haven't got, then your benefits are down a little bit. And revenues, the big thing with them, which I guess we're going to explain in another, but I just wanted to bring to your attention that we did get a state stimulus funds, 2 checks that totaled $157,752.71. And we got those in the month of April, and that's funds that we do not have to pay back. It was for our home care because referrals were down, and I guess just the state has given us, we were kind of surprised when we got 2 within like a couple weeks of each other, but at least those revenues are also reflected in our home care program.
Thank you very much, Tom.
Mr. Chairman.
Any
Mr.
question, Supervisor Conover? Go ahead.
Thank you, Mr. Chairman. Really, Tom, just a comment, really, considering what's been going on, these numbers look remarkably good. I congratulate all of you. They are, I don't know what the future holds, I get that, but at least to this moment in time, it seems to me you're doing an awful lot with the resources that you have. Am I wrong in that assessment?
Tom's been doing a good job trying to find us money.
Well, Janelle, that's really quite excellent, really. You should all be commended.
We have a great health services department. You're absolutely right.
Thank you. Any further questions from it? Any members? Doug, did I see your hand up?
Supervisor Conover said exactly what I was going to say, so I'm just going to say I concur with Ron, with your statement, and I'm blown away by these numbers, considering the time we're in and the challenges. So phenomenal job, and as Ryan Moore just said, we got a great health department, and I don't think anybody disagrees with that. Thanks, Janelle.
All right, so moving along to our next attachment number 3, status of referrals. We actually have good news to report there. We're actually up by 3. So our home care nurses are still out and about, just so you know, doing their work, and we appreciate what they're doing. A couple weeks ago, we had Nurses Week, and we spent a lot of time showing appreciation for them and the great job that they're doing. Then we have the emergency response and preparedness report for you on number 4. As you know, most of that is related to COVID, and life is still going on with rabies. Our rabies report is attachment 5. Moving right, just one thing to note, our rabies clinics are suspended right now, so we haven't been holding those until we're able to have public gatherings. We can't do that. So we still encourage dog owners to keep their animals up to date. We're starting to get into the warm season where other animals are out and about and animals can come in contact. So people should follow up with their veterinarian. If there are concerns, they can contact public health, and we might be able to work out something with the veterinarian to get them vaccinated if needed. And they don't have the resources to do that. Jumping to Further items, Ton already mentioned the good news of us getting our stimulus money in 2 payments. We received the first one in the amount of $93,000. We received the second one in almost a little over $64,000, $64,747.51. I wanted to provide a brief COVID update. I know Ryan's been sending you updates every day, and I appreciate the time that he puts into that. I also appreciate Don Lehman and his efforts in trying to keep us up to date with the press releases. And his patience, I don't always get back to him due to conflicting priorities, but he's doing a great job. Where we are right now is our total lab confirmed cases are 221. Our total recovered is 141. Our deaths is 29, and that's a horrible number to have to report because we are attached with all of our families. We're attached as we work with all these cases and all the facilities, and this number it doesn't do justice for the pain and suffering and sacrifice that the families have had to go through with these deaths. But please know that our thoughts still remain with these families, and our hearts are still broken for them. We were able to actually do a yoo-ha or hooray for a family that had 3 members had been affected with COVID, and the case that's been in ICU was actually a plasma recipient, was able to be discharged from the hospital to an out-of-state rehab. So we are thrilled to death for that family and still maintaining contact as we're still concerned as to what goes on with that family. As far as total quarantines, and again, I have to thank the county attorney's office and also the sheriff's office for assisting us, in addition to our staff and all the time and effort. We have to date done 339 quarantines. 301 of those are complete, and we have 38 active. Our precautionary quarantines, we've done 92 to date, where 72 have been completed, and we have 20 active for that. Our testing clinic is going well. We have done 769 tests to date there. I'm calling today Contact Tracing Day. Last week, we had over 20 staff that we trained the Warren County way, and we trained over 26 community volunteers, including our Supervisor Hogan, last week from the Warren County way. And then over the weekend, we kind of learned that we couldn't count our contacts or our contact tracers unless they had the New York State Johns Hopkins training. Actually, we found out yesterday afternoon. We put out a quick reply and request to all of our volunteers and our staff to try to get that done today. And so many people were responsive to that need. I can tell you I got 4 responses after 11 o'clock last night with certificates for this 5-hour program. I'm thinking that we'll have 30 certificates by this evening, another 9 by tomorrow. And there's 12 people that I'm not really sure when they're going to be able to get it done. Some of those might be done today, which would be a nice surprise. Some of those might be done Tuesday. I do know that a couple people on my list, some have some family emergencies that they're working through right now. But, for the most part, we should be very proud of our volunteers and our staff for, taking this initiative so seriously, acting so quickly, and being dedicated enough to go through this. I actually have clerical staff going through the training today, so that's why we're calling this Contact Trace Training Day. We've been working very hard with the nursing homes. As many of you know, last week, the governor, actually a week ago Sunday, the governor put through an executive order requiring our adult homes, nursing homes, and assisted living to test their staff twice a week. Huge undertaking. That's over 1,500 a week for Warren County alone. Many of our resources, such as our testing trailer, Hudson Headwaters, providers, and the hospital, serve multi-counties, and we did not have the resources for this. So we strongly have advocated with OES, through the state, through our state health department contacts, through the people over nursing homes, and adult homes. Ryan's office has been great in working with the governor's office. It does appear our facilities are going to be getting some supplies this week, which is absolutely awesome. It just shows how wonderful the teamwork is and how communicating up the chain on all levels and all silos works well, which I think reflects the bottom group or the bottom, line as far as everybody working very well as a team, whether it be facilities, the hospital, the providers, or whether it be our own administration, board of supervisors, or other departments like OES. We've, I think are starting to get a better answer than we had last week. So I'm very hopeful and happy for that. My tired brain, I am hoping I don't miss anything, but if anybody has any questions, I'm more than happy to entertain that.
Supervisor Conover.
Thank you. Janelle, just really a comment. I really don't want this to get by, and it deals with our CHA staff. I mean, to put this in perspective, these soldiers really during this pandemic are going out into our county and doing last month 1,124 visits, and frankly, they don't always know what they're walking into, as you well know. And a shout out to all of you, of course, but in this example, a special shout out to all of the CHA nurses and the CHA people that are going out to those households and providing those services during a pandemic. I mean, you talk about dedication and courage. That's dedication and courage. Thank you.
Thank you, Ron. Ryan.
And can I also just piggyback on that? And that's also to the credit of the Board of Supervisors for still having a CHA, because a lot of counties have privatized that function. 5 years ago, I played a part in privatizing that function in Saratoga County, and we were wrong, because at a time like this, Warren County has an easier time responding to the crisis than a county that's disposed of that function. So thank you to everybody that's been involved in that.
Thank you, Ryan. Any further comments from anyone? Well, good. Thank you very much. I do appreciate everyone's efforts. Can I get a motion to adjourn? By Doug, seconded by Supervisor Conover. All those in favor?
Aye.
Opposed?